Hello, everyone. My name is Danny, and I am one of the dietitians here at Mercy Iowa City Bariatrics program. So these few videos will be taking you through nutrition goals prior to bariatric surgery for your safety and success after bariatric surgery. It'll be split into 3 video segments, and this first one will be going over eating habits. You can view each slide or each topic as a goal for yourself. And again, we do want these achieved prior to your bariatric surgery. The first goal is to eat 3 small meals daily. And this is something you will definitely be working on more and get more information one-on-one with your dietitian. But for now, just knowing it's very important to make sure that we're not consistently skipping meals. This is very important after bariatric surgery, as your stomach will be quite small. So if we're skipping meals, it's going to be really hard to meet your nutrition and protein needs with just eating a couple times a day. Going hand in hand with that is we also highly encourage high protein snacks throughout the day. So as we are reducing the size of those meals, it is very common to also incorporate some healthy snacks. And again, we will talk a lot more about this one-on-one in your next dietitian session. Next, we ask that you allow 30 minutes to eat your meals. It does take the stomach about 20 minutes to feel fullness once you have started eating. So really what we're doing is allowing the mind and the stomach, or the mind and body, to connect and talk to each other. If we're eating our food in less than 20 minutes, we could be full and just quite literally not even feel it or sense it yet. So we really just need to slow down, have that mindfulness so that we can feel fullness at its first signal rather than feeling it much later when we are stuffed. Another way to look at this is eating until you are no longer hungry rather than trying to eat until you are full or stuffed. I just want to say off the bat with this slide that this picture to the right is showing things in regards to what we call a sleeve gastrectomy. So in your first appointment with your medical provider, they will be going over all of your surgery options and which one they might recommend most to you. So this will become a lot clearer in your future. But for now, I'm just going to show this in regards to the sleeve gastrectomy, as that is our most common bariatric surgery to date. So as you can see with this, we are actually taking out a large percentage of your stomach. What's left is your esophagus, which is the top part of your stomach there, or the part in your throat that leads to your stomach. And really what's happening and what we're left with is an extension of your esophagus. So your esophagus runs right into your stomach there. And if we're not chewing our food to the consistency of applesauce, it quite literally can get stuck in that outlet between your esophagus and your stomach, which unfortunately can be a very uncomfortable feeling, and it can be a safety issue as well. So again, we do want to chew foods to the consistency of applesauce to prevent this. For some foods, that'll only take just a couple chews to get there. For some foods, it's going to take quite a few more chews to get to that consistency. Another reason why chewing your food adequately is very important is because, to put it simply, your stomach will not be able to digest food quite as strongly as it did prior to surgery. So in essence, what we're doing is we're digesting the food in the mouth with chewing it very, very well. That way, once it gets to your stomach, we can really pull the nutrients out from that as it works its way through the rest of your digestive tract. We also ask that you avoid acidic foods and beverages after your bariatric surgery. For the sleeve gastrectomy, this would be for 6 months after surgery that we would want to avoid these foods. And for the bypass, or commonly called the Roux-en-Y, that would be lifelong, that we would want to avoid these acidic foods and beverages. The main reason for this is we're trying to prevent extra acidity or acidic juices in the stomach after surgery. It does take the body a while to kind of get used to that new stomach. So, for quite some time, we're already overproducing gastric juices for our small stomach. We do have patients start on an acid reducer, which helps combat that. But if we're adding on additional acidity from our foods, that can be an issue for sure. So, how we would avoid acidic foods would mainly be avoiding those foods listed on the bottom. So, that would be your tomato products like tomato juice, tomato sauce, salsa. Our fresh tomatoes are not quite as acidic as our canned or cooked tomatoes. Would also be your citrus fruits such as lemons, limes, oranges, and pineapples, as well as your spicy foods like hot sauce, hot peppers, and our hot seasonings like chili powder or cayenne powder. Lastly, for eating habits, we do ask that you record your food intake daily. And this is actually a requirement for our program. So it is totally up to you how you would like to go about that. You could journal it on a piece of paper or journal itself, or you could do this through an app. I've got a couple apps listed on the bottom there that tend to be the most user-friendly options. It is more recommended to be using the app if that's something you're comfortable with. And that's simply because it makes it a lot more efficient for you and to be able to clearly visualize where you are at with things such as calories and protein and fiber, and the list goes on. It really does a lot of the guesswork for you. And that is it for the eating habits portion of the series.